I am so excited. We have a fabulous guest this week on Dental Culture Convos. We are going to be talking to the fabulous Amanda Hill, who is an enthusiastic speaker, innovative consultant, and an award-winning author. She brings over 25 years of experience to educate the dental industry on all sorts of hot topics, and you may know her as the Waterline Warrior. Please welcome Amanda Hill. I'm so happy to have you, Amanda.
Carice, thank you for having me. Once upon a time, you were a guest on my podcast. So this is fun that now I get to be a guest on yours.
I know. How exciting.
Yeah.
How exciting.
Who
knew? I didn't even know back then.
I don't even know. Like, I don't know what I'm doing from day to day. I mean, I can't, like, that whole, like, where will you be in 5 years? I'm like, I don't know.
Exactly. I don't know either. No. Okay. So we know where you have been. The last few years, you have been on an amazing trajectory. You are even a recipient of the Association for Dental Safety's Emerging Infection Control Leader Award. And so I'm really curious, how did you even get into infection control?
You know, like most things in my life, it happened by accident. So I actually was, my family, we had lived in Germany. My husband's in the Navy and we moved back to the States. And I went to my annual infection control update, OSHA infection control, like we're all supposed to do, clinicians, all of us. We need an annual update. Anyway, so I went to that annual update and this speaker started talking about dental unit water lines. And I was like, I don't think our office is doing that. And so I went back to my office and I was like, guys, do we do this? And they're like, no, we don't do this. And I was like, oh, we got to do this. This is important. I'm going to take it over. And they're like, great. And so I started testing and shocking water lines and failed miserably. And, you know, I think the best way to educate people is through my failure. So, So anyway, so I started, figuring kind of this system out. And then I started talking to like the hygienist in my kind of circle, my component in my area. And I was like, are you guys doing this? And they're like, no, we're not doing this either. And I was like, I think there's a void here. And so I started writing some articles about it. And then managed to a dental unit waterline company reached out to me and they're like, hey, do you want to do a webinar for us? And I was like, sure. I'd never done that before, but I didn't tell them. And I built a deck and I did a webinar for them. It kind of worked out. I mean, I think COVID was my friend at that point because this was all prior to COVID, but like that first webinar happened early COVID. And that's when people like all of a sudden got really curious about infection control. Like they're like, oh, maybe we should pay attention to this. Okay. So then from there, it kind of took off. And so I talked about water lines and then people get water lines and suction lines confused. So then I wrote a suction line course and then I just started talking about general infection control and I talk really loud and fast. And so somehow that got a lot of attention.
I think people love it. The energy around it. It's a topic that I think most people don't have energy around, but your energy just kind of reverberates.
That's the goal. It's like, putting a good vibe into infection control.
I love that. And so that is a great way of really addressing patient health and safety. And I think that is paramount in dentistry. We need to be sure that we are keeping our patients safe. But safety, it also transcends just the biological health and safety that we are accustomed to talking about and that OSHA will, really regulate. So when we're looking at patient safety, there's also a component about it. And you're talking about new topics in the near future. Patients of a certain population, but patients and their mental health and their emotional safety when they come into the office. Yeah. And so do you want to introduce a new topic that you'll be talking about in the future as you're putting together some new courses?
Absolutely. I have a new course coming out, and I'm happy to say that it's actually scheduled a few times in 2025. I'm thrilled. And it's about our transgender population. And I've titled the course Transgender 101, but the idea is about why we should care about this population, why it's important for us as healthcare professionals to make this population comfortable in our office. But I want to take it. The course is going to go a step further. And the course is also going to go into how do we actually make safety around gender and around sexual preference. And how do we And why does that matter? And so sometimes I think that offices are like, well, we don't see those kind of people, right? We don't have to worry about that. And I'm going to throw a red flag. I'm going to throw a flag on the play. And I'm going to say, actually, you have no idea. And you have no idea how the patients that you're seeing are connected to that population. Even if you think we don't have that population, we don't need to worry about this. I will tell you, as a cisgendered white woman, middle class, military family, I have a transgender daughter. And this is sort of what opened my eyes to this. This is something that I never thought about. I never talked about. You can see on my name, I have my pronouns there. Nothing that I talked about or thought about. No, I didn't think it was important. I didn't think that wasn't that wasn't who was in my circle. But now, as a mother of a transgender daughter, if I go somewhere, let's say I go to the dentist, okay? So here I am going to my dentist, and I see on a form that you're asking my pronouns. What that says to me is that this is a safe place for me to be open as a patient. And it says that that my daughter would be safe here. It says that my things that I'm concerned about and that affect my day-to-day life is safe here. And so it goes beyond just that specific patient. It goes into everyone that is involved in that. And I think, we're learning more and more and more about that. And I think people are becoming more comfortable to be able to have those conversations with remember, we're healthcare providers, right?
Yes. Absolutely.
So yeah, so that was probably a long answer to that question.
I love that. No, it was a great answer. It was a fabulous one. I think just to kind of step backwards for 1 second, just for those who might not understand what you mean when you say transgender, can you just give like a really baseline description of what transgender means?
Absolutely. And this is a confusing thing. I got to tell you, when my daughter came out as transgender, I had to do a deep dive into learning. And I still don't consider myself an expert, but man, do I consider myself like a fierce mama bear. So what we're talking about when we say transgender is there is a difference between biological, like this sex assigned at birth, versus how someone identifies. So my daughter was born, identified male, or, was male at birth. That's how she was assigned, and then identifies as female. So, and you can have it the other way around, and you can also have people that live in that kind of in between world, and we call them non-binary. So we have trans male, we have trans female, and we have non-binary, and so there's lots of different terms around that. But one thing I want to say is that that's gender, which is different than sexual orientation, and those live in like two sort of parallel worlds. They don't necessarily, one doesn't mean that you have to go this way or this way or this way. There's a lot of fluidity around that.
Yeah, that's a very important distinction, because I think a lot of people cross associate those terms and they're not related in any way, shape, or form.
Yeah.
So thank you for highlighting that. What are some things that we should be aware of if we're in the clinical office and we get a transgendered patient? Are there some common misconceptions that we should probably debunk at this moment?
Well, I think that there are, without a doubt, I mean, first off, just pronouns, flat out pronouns. And it's funny because I've had this conversation a lot where people are like, well, why do you put your pronouns after your name? Like, obviously you're a she, her. Sure, I am a she, her. But what having my pronouns on this Zoom call, or having my pronouns, let's say, when I write them out, says that I am open to your pronouns. So first off, it's creating an inclusive environment, but understanding a patient's pronouns. Now, in the medical world, since we are, in healthcare, there might need to be on your form, there might need to be sex assigned at birth for insurance reasons. Right. And so sometimes that gets a little like uncomfortable for some patients, but then understand that we're going to still say, what are your preferred pronouns and what is your preferred name? It's just like any of us have a nickname, right? When I was little, I went by Mandy and now I'm Amanda, and so we can honor that. I also want to discourage people from asking inappropriate questions. And it's funny because my daughter doesn't get as many of the inappropriate questions. I get them because I think people feel a little like it's once removed. So I can ask the mom, or I can ask Amanda some questions. And some of those, I am amazed by the questions that people feel okay to ask me. One important question to never ask, because it's none of your business, is, are you going to have the surgery? And the reason, I get that we're curious. I get that we're like, I don't understand that. Like, I want to understand that. But when you think about it under this context, Carice, I don't think a lot about your private parts. I imagine you probably don't think a lot about my private parts. Everybody's private parts are none of anyone's business, right? And so that's often one of the first questions I get. Oh, is she going to have the surgery? You can be transgender with or without gender affirming care. It doesn't mean that one has to happen. And each person gets to decide that for themselves. What do they want that to look like? How do they want to proceed? I've even had people ask me about how my daughter has sex with her wife. I don't really want to think about my kid having sex. That's my kid.
No. Oh my goodness.
So these are inappropriate questions that actually aren't your business, particularly as a healthcare provider. So what I do, though, one thing I do want to say is, like, so let's say you have a patient in your chair and you suspect perhaps they might be, transgender, they might be non-binary. You can say something like, and if it's somebody you've been seeing for a long time, right? You can say, hey, we're updating our medical histories and we're putting on preferred pronouns. Would you share with me your preferred pronouns? What a nice way to sort of enter that conversation, to say, I am open to understanding more about you. As I've gone down this journey, what I've learned is a lot of times the first people that someone comes out to, or that their loved ones come out to, meaning like me as a mom come out to, that I have a transgender daughter, is the dentist, which is fascinating.
Wow.
Yeah. And it's almost a tiptoe into, is my child going to be safe here? And I got to tell you, when my daughter is 25 now, and that concerns me. Like, is she safe in different healthcare arenas, or will somebody, say something that's inappropriate? And so a lot of times we as parents, we as loved ones that love a transgender person, will go into, these spaces to find out, is this going to be a safe space for them? Mm-hmm. And I will find out it's a safe space by things like pronouns, things like, what does their medical history look like? But what I've learned recently is that it's time for me to even get better about how I have conversations, regular conversations with my patients. So as a clinician, how do I have conversations? So some of those things are starting to pull out gender specific pronouns from our conversations. So recently I was at the doctor and she, we're doing the chit chat, right?
Yeah.
And she asked, she's asking me, oh, do you have children and how old are they? And so I mentioned, oh, I have a 25-year-old daughter and she just got married. And she's like, oh, do you like her husband? Well, she doesn't have a husband. She has a wife.
Right.
Or like, well, at least it's a girl, so then so anyway, there's a lot of like assumed things. So if we can pull pronouns out of it to say, oh my goodness, how do you feel about their spouse? Oh, that's so great. If we can do some of those more gender neutral things, I think I got good at this with parents, instead of like when I spoke to children about saying mom or dad, you could say like, who brought you today? Things like that. We kind of got good about that, because we sort of learned that not everybody has like a mom or a dad. And so doing the same thing to make all of our patients comfortable, to try to pull out some of those gender stereotypes that we have. I don't know. Did I just jump the shark on this one? I feel like I did.
No, I think that that's actually a really great suggestion, because oftentimes you don't think about these things. Things just come out of your mouth. We're working, and technically we're supposed to just be focused on work, right? Like I'm cleaning, I need to be focused on medical history and all these things. And so as I'm creating this small talk, I'm just saying the next thing that comes to my mind. I'm not really thinking about how exactly it may come across, or how it may make them feel, or whether what I'm saying is accurate. based on their pronouns or what's going on in their life. So I think that that's incredibly important. It's no longer something that should be an afterthought. It should be at the forefront of our mind. Just remove anything that might be gender specific.
Yeah. And then I think you asked about other things about the transgender patient. We do find that statistically, the transgender patient often will have some barriers to care. Some of that could be the socioeconomic status, and some of that could be from a mental wellness status. So you might see traditionally, stereotypically, you might see more depression meds and things like that, which then can lead to dry mouth. And so from a clinical perspective, those are things that we're going to look for with our transgender patients. But certainly not everybody. It just kind of depends on who's in your chair. I think I heard somebody say this, and I think it's so true. If you know one transgender person, you know one transgender person.
Right.
Right.
Right. Because they don't represent a whole community.
Right. Right. Yeah. Exactly. So yeah. So one transgender mom, one transgender mom. This is, but I'm learning. And so if anybody on here is like, oh, that's not true, you know what? It might not be true in every situation, right?
Absolutely. Absolutely. Well, I love that you're learning. And I think an important part of learning is have the right resources. Do you mind sharing any of the resources that really helped you on your journey that might help others as they're either navigating their own personal journeys or as they're trying to learn more so that they can better accommodate their patients?
Absolutely. So there's actually a great article in Dimensions of Dental Hygiene magazine that Sam Vest wrote. And Sam Vest is a non-binary dental hygienist. I love them. Amazing person. And it has some really great information about, pronouns. It talks about meds. It really has some great, and in fact, you should invite Sam to CultureCon because Sam is amazing. I could totally introduce you to them. And notice, I'm working really hard to use my they, them pronouns when I speak about Sam. That's a toughie, by the by. But if you screw up pronouns, let's say I accidentally did that, I would just correct myself and continue to move on. And so as you are starting this journey, you will screw up. I screwed up. Do you know how long it took me to call my own kid by a new name? I mean, after 22 years of calling my kid by a different, tough. And so you just keep doing your best and just, help yourself, just kind of correct yourself when you hear it and then move on from there. But anyway, so that's a great one. As a parent, there is a website that's a blog that saved my life, I think, and it's called Just Plain Beth. And this woman has two, she's a non-binary child and a transgender child. So non-binary would be, we don't identify as male or female. And then she has a transgender son. And she really helped me as a parent understand not only the transgender world, but understand as a parent the difficulty it is to have a child become, be transgender. And some of that is around my own feelings. We have, if any of you are parents, like we have these dreams and hopes and expectations for our kids. And, and my daughter was 22 and I only, knew her as this other person in my head, right? My head, but that was my head, right?
Right.
That wasn't her head. And so you almost go through this grief process of losing this child, but it's more losing an idea of a child, but it's still a really difficult thing. And so she really helped me as a parent understand that my feelings were okay, because we feel our feelings, but then how to move on from our feelings and how to best support my kid. And I truly believe, Carice, like it is my job as a parent. It's probably my job as a human to just love the heck out of my kids and love the heck out of the world. Right. But just love the heck out of my kids, and not decide what I, not take what I think or what I, values that have come to me, and be willing to sort of open my mind and just be there for my child. And so that's what I've worked really hard to do.
I love that. Okay. As we're winding down, I want to give you the floor if there's anything else that you think that we forgot to talk about regarding this topic. And then we're going to transition into some rapid fire questions.
Okay. I think we probably forgot to talk about a ton, but we don't want to spend like 2.5 hours here. But what I would really encourage you to do is, I'm not even suggesting that you don't have to fly a rainbow flag outside of your office. You don't have to go that far. However, I will say having some subtle things that say that patients are safe in your office is really great. Do you have some sort of like little, rainbow flag magnet sticker somewhere in your office that, people could see to be like, oh, okay, maybe I'm more comfortable to be my true self and open up here. I also would say really look at your medical histories with this new like knowledge, kind of this new open eye to say, okay, how can we make this feel more inclusive, even if we don't think we're seeing transgender and binary, non-binary patients. And because I got to tell you, you're bringing in a whole family, whole families. You think about my parents. My parents are in their late 70s. Well, now they're parents of a transgender grandchild. And so when they see things like pronouns, they get it. And they're like, oh, this is so nice. They support my child, my grandchild, right? But you think like it's so far removed. No, it's not that far removed, right? Because we love the heck out of our families, right? So I would encourage you to do that. And then I would encourage you really to think about, how we gender our speech, and how you can maybe pull back some of that gender just to allow people that space to be themselves.
I love that. That was a beautiful way for us to end. Okay, let's get into a little bit about you. I've got 3 rapid fire questions. You can take a little time if you need to answer. All right, you ready?
Okay, I'm ready.
What's the best piece of advice you've ever received?
Oh, the absolute best piece of advice I ever got was from my mother-in-law the day before I married my husband.
Oh.
Yeah. And she sat me down and she's like, listen, I'm going to give you one piece of advice. And she's like, I promise after this, I won't be giving you advice. She's like, there's going to come a day where you're going to look across the breakfast table and you're going to gaze into your husband's eyes and you're going to think, what the hell was I thinking? And she said, don't stress about it. She's like, go for a walk. She's like, just relax. She's like, it's a normal feeling. And she's like, and it probably means that you're not taking care of yourself. And I got to tell you, I heard the first piece of that advice and really understood. I remember the first time I looked at him and was like, what? And I remember I was like, okay. I know. I don't think I understood the second piece of that advice. And I'm paraphrasing it because I don't know exactly how she said it, but I don't think I understood the second piece of that advice until probably within the last 3 to 4 years, where I'm like, oh, that's what she meant. That, when you're not taking care of who you are, I think we put way too much pressure on this other person in our lives to fill the void that we're not filling in ourselves. And so to me, that piece of advice, I think that's the reason I'm still married. We just had our wedding anniversary, 27 years, because darn it all, there's probably at least 27 times I would have divorced him. I get
it. I get it.
Yeah. So take care of yourself.
I love it. That is excellent advice. Exceptional. Okay. What's something you wish you knew 10 years ago that you recently learned?
Oh, that's probably just part of that advice, that how important it is. I think how important mindset is, which sounded woo-woo to me. If somebody's like, oh, I don't know, you can talk yourself into something or whatever. It's not talking yourself into anything at all. It's really sitting in a space where you are comfortable with who you are and that you are making decisions that are right for you, not necessarily right for everybody else. Right. And so understanding who I am, what brings me joy, what I'm good at and what I'm not good at, and being able to sit in that right headspace and being okay with all that. And I think once you get there, life is a lot more fun.
I love it. Okay. Last one. If your life had a theme song, what would it be?
Ooh, okay. So there's this song called that I listen to all the time when I get like a little like flustered, right? I don't know. Do you have that like music, music tries to bring you back? And now I'm blanking on who sings it, but it's called I Am a Difference Maker. Need to Breathe is the name of the band. It's actually a Christian band. But it talks about I am a difference maker. And I think that's so important for those times when you're like, okay, what am I doing? Why am I doing this? And it really helps me recenter to say, okay, I am everything I am doing in hopes that I am making a difference in the world. And so I would like to think that, like one day down the road when I'm gone, people will be like, she really made a difference. And so my theme song is Difference Maker.
I love that. And you truly are a difference maker. I think even in just this episode, you've made a difference in someone's life and how they're going to look at things going forward. Okay, Amanda, I know you're all over the place. You're speaking everywhere. We can read your work in, various publications. But where can people connect with you if they want to follow you or figure out what you've got going on?
So I make it pretty easy. It's Amanda Hill RDH. Amanda Hill RDH on Facebook, Amanda Hill RDH on Instagram, Amanda Hill RDH on LinkedIn, and my email is amandahillrdh@gmail.com. Oh, and my website is amandahillrdh.com. So super easy. Just type it in.
I love that. Thank you so much for being with us. I think I've learned a lot, and I hope everyone else has as well. And I look forward to seeing what you have in the future.
Thank you so much. Thanks for having me. It was fun to be on your podcast this time.